Hi, this is Dr. Mohammad Zahid Khan from Excel Orthocare. Today we will discuss about the different portals that are used in shoulder arthroscopy. So, accurate portal placement is actually a very important step while doing shoulder arthroscopy. So, before going to portal placement, let's see what are the different bony landmarks that are used in shoulder arthroscopy. So, let's see. This one is the clavicle. This one is the acromion. This is the spine of scapula. This is the anterolateral corner of acromion. This is the posterolateral corner of acromion. So let's get started with portal placement. The first portal that is made is the posterior portal or standard posterior portal. This portal is the primary viewing portal of the glenohumeral joint. It is made 3 to 4 centimeter inferior and 3 to 4 centimeter medial to the posterolateral corner of the acromion. This portal is made blindly. While going into the joint, our trocar should be directed towards the coracoid process. The second important, the posterior portal is actually made blindly. Rest of the portal is made by viewing inside the joint by outside in technique. The next portal that is made is the anterosuperior portal. The anterior superior portal is midway between the coracoid process and the AC joint. This is the anterior portal. It is at the level of the coracoid process and it is 1 centimeter lateral to the coracoid process. The anterior superior portal and anterior portal both are used in the Bankart repair. The next portal is the posterolateral portal and the lateral portal. Posterolateral portal is 3 to 4 centimeter inferior to the posterolateral corner of the acromion and 4 centimeter lateral to the standard posterior portal or the posterior portal. This portal is the viewing portal in case of rotator cuff repair and the subacromial decompression. The next portal is the lateral portal. Lateral portal is 3 centimeter lateral to the edge of the acromion, 3 centimeter anterior, 3 centimeter lateral to the edge of the acromion and at the level of the clavicle. This portal is basically the instrumentation portal and it is used in the subacromial decompression and the rotator cuff repair. The next important portal is the inferior posterolateral portal or the low posterolateral portal. This portal is midway between the posterior portal and the posterolateral portal. This inferior posterolateral portal is used in intra-articular loose body removal, for the anchor placement in posterior glenoid, for the suture passing in case of from the labrum, and the posterior capsular release in case of adhesive capsulitis. Another important portal is port of Wilmington. It is 1 centimeter lateral to the edge of the acromion and 1 centimeter anterior to the posterolateral corner of the acromion. This port of Wilmington is used for anchor placement in case of slap repair. Another two important portal is the Nevasier portal and modified Nevasier portal. Nevasier portal is at the apex made by the clavicle and the spine of scapula. This Nevasier portal is used for the visualization of the anterior glenoid and the suture placement in case of anchor placement in case of slap repair. Another important portal is modified Nevasier portal. This portal is just behind the Nevasier portal or 2 to 3 centimeter posteromedial to the AC joint. This Nevasier portal is used for the retrograde suture passing in case of rotator cuff repair. So this is all about the portal placement in shoulder arthroscopy. Please follow us on Facebook, Instagram and sportsenergysolution.in. Thank you.